Hello, my name is Emily Wagner. I am here to defend my thesis, the title of which is Correlating Direct and Indirect Executive Functioning Measures and Language Skills of Children with Autism. Jumping right in, executive functioning has a lot of different definitions, but it usually refers to one's ability to regulate one's behavior, to set goals, be mentally flexible, and understand the consequences of one's actions. So a couple of examples of that would be reacting with the right level of emotion to different situations. So not being overly excited or overly angry when the situation doesn't warrant it. Another example would be a child sitting in his or her seat during class time when it's time for learning. Executive dysfunctioning is a deficit in the skills mentioned above. So for example, having trouble in new situations, not reacting well, or not understanding that how one behaves affects others around them. There are many different populations that experience executive dysfunctioning. A couple include individuals with a traumatic brain injury. Individuals with Huntington's disease suffer a progressive decrease in executive functioning, and it's often seen in individuals with autism spectrum disorder. Autism spectrum disorder is a neurodevelopment disorder that has a wide variety of symptoms. No two cases of ASD look the same. This population often has difficulties with executive functioning, however. Right now, applied behavior analysis is the most effective treatment for ASD, but when it comes to executive dysfunctioning, currently the most common treatment method is an individualized education program. There hasn't been much research with ABA and executive functioning treatment for autism spectrum disorder. With extensive research on ABA expanding repertoires with people with autism, it makes sense that this may translate into improved executive functioning skills. It just hasn't been shown too often yet. Currently, there are a couple of studies looking at ABA's effects on specific targets. For example, Dixon and Cummings were able to target self-control by having children wait for a better reward rather than taking a smaller, sooner one. Horner was able to target maladaptive behaviors by putting children in a enriched environment. And the good behavior game, which targets behavioral regulation, is a tool that's often used by behavior analysis and is used in classrooms around the world. Currently, there's not too much research assessing and targeting executive functioning in children with autism, particularly with ABA therapy. The current study examines ways of assessing executive functioning compared to a behavioral language assessment. We had 39 participants for this study. They were from a Center for Autism at the university. They were between the ages of 4 and 16. 10 were female and 29 were male. They were assessed individually in therapy rooms, which were about 2 by 2 meters. They were seated in a chair at a low table. We had 4 different assessments, each with its own materials. The first was the Peak Comprehensive Assessment, or the PCA. This was our direct behavioral assessment of language. We needed the flip book for the PCA, which contains the questions that were asked to the participant, the answer booklet, the assessment sheet to mark correct or incorrect answers, and a pen or pencil to do so. We had 2 indirect assessments of executive functioning. The first was the Comprehensive Executive Functioning Inventory, or the CEFI. All that was needed for this was the assessment itself, which was a little paper packet, and a pen or pencil. The other indirect assessment was the Behavioral Rating Inventory of Executive Functioning, or the BRIEF. Same materials were needed for just the paper packet and a pen or pencil. The other assessment we used was the Tower of London. This was a direct assessment of executive functioning, and it specifically measured planning. We needed several items for this. The Tower of London itself is 2 wooden puzzle boards, which come with 3 beads each. We needed a timer, which in this case we used a phone, the assessment to mark correct or incorrect answers, and a pen or pencil to do so with. The PCA was done directly with participants in the therapy rooms. They were under strict test measures. They were not given reinforcement when given correct or incorrect answers. Breaks were given if needed, and if a question was not answered within 3 seconds, it was marked as incorrect and moved on to the next question. The CEFI and brief were both given to parents or caregivers of the participant during their therapy sessions. They were asked to fill them out during that time in the waiting area. Some chose to take them home as they were not staying in the waiting area during their child's therapy session, and that was allowed. They were asked to rate how often their child performed certain actions. For the CEFI, the higher the score was, higher executive functioning was said to be. For the brief, the lower a score was, the higher executive functioning is said to be. The Tower of London was done directly with participants in the therapy rooms. There are 2 boards, as can be seen in the bottom middle of the screen. They are set in the middle of the table, a couple of inches away from the edge, so that they are in easy reach of both the participant and the assessor. The goal of this is for the participant to make the same design as the assessor, moving as few beads as possible one at a time. They are recorded on the total time it takes them to get the correct answer, the first move that they make, and the time in between the first move and the total time. Also written down is their total move score, so how many beads that they move to get the correct score. Anytime they violate a rule by moving 2 beads or putting more beads than will fit on a peg is recorded, as well as how often they get the correct answer in the minimal moves possible. Pearson correlations were conducted between the PCA and its different subtests and all of the measures of executive functioning listed on the previous slides. Additionally, correlations were conducted between the indirect and direct executive functioning assessments on the planning subtests. This was done because the Tower of London specifically measures planning, so we wanted to see if there was any correlation between the indirect measures and the Tower of London, as well as the PCA. We saw no significant relationship between the PCA and the CEFI. There was a moderate negative significant correlation between the PCA and the brief. This makes sense because, again, the lower a brief score, the higher executive functioning is said to be. There was a strong, positive, significant relationship between the PCA and the Tower of London. Again, this was our direct measure that measured specifically planning. When taking the planning scores out, the only relationship seen was between the CEFI and the PCA. No other areas matched up. The Tower of London didn't match up with either the CEFI or the planning significantly. When the PCA was divided into its subsections, the Tower of London strongly positively correlated significantly with the Tower of London in every subsection. It did not correlate significantly with the brief or CEFI in any of them. The current data shows that there was no correlation among the various tools used to measure executive functioning, even when the planning section was taken out and run separately. The behavioral measure, which was the PCA, held up to a high correlation with the direct measure used, which was the Tower of London. This was true for each subtest as well as the total PCA. The only other relationships seen were between the PCA and the total brief, and the PCA and the CEFI planning scores. Both of these were moderate. Executive functioning is a construct for many behavioral repertoire elements addressed by applied behavior analysis intervention. This means that ABA could help improve overall executive functioning. It just hasn't been tested too often yet. With the PCA being a ABA assessment tool, it makes sense that using something like this could also measure executive functioning levels. We had several limitations for this study. The first is that some participants had prior experience with peak and others had not. We did not make those two different sample sizes, sample populations. The size variation between the assessments, we had different assessment sizes for each assessment. We had a rather small sample size for a correlational study. Children under the age of 7 took the Tower of London. This assessment is meant for children between the ages of 7 and 15. We had a couple that were under the age of 7 that we put in the 7 to 9 age category. Our population was rather homogeneous. They were all from rather small rural towns. Challenging behavior did happen during some of the assessments, and that had to be dealt with and then returned back to the assessment at hand. The indirect assessments themselves could be considered a limitation also. We had several instances in which a parent or caregiver would say that their child never performed a behavior when we had witnessed it frequently, or often or always performed a behavior when we had never seen it. Future research should look at several things pertaining to this. Executive functioning has not been extensively studied in behavior analysis. Other areas of executive functioning should be targeted for improvement by behavior analysis or behavior methods. Continued research and practice should make use of the measures of executive functioning, particularly direct measures. There's several of them out there for several different parts of executive functioning to assess for changes in these skill sets. By incorporating measures of executive functioning, progress using ABA treatment may be used in different fields that use executive functioning as an important measure of progressive outcomes. So ABA may have a lot of different areas that it can reach that it hasn't reached yet because it hasn't looked too extensively at executive functioning. Thank you so much, and I hope you have a great day.